Pulmonary cavities are hollow spaces in the lungs that can be caused by infections, immune responses, or tissue damage. This video will cover their diagnosis, management, and the latest advancements in treatment. It is designed to educate medical students and healthcare practitioners. Now, let's dive into the fascinating world of pulmonary cavities. The formation of pulmonary cavities involves microbial invasion, immune responses, and tissue destruction. Understanding these processes helps diagnose and manage the condition. Pathogens like Mycobacterium tuberculosis and Staphylococcus aureus trigger cavity formation by releasing virulence factors that cause inflammation and tissue damage. Immune responses contribute to both tissue destruction and infection control. Enzymes and reactive oxygen species also contribute to cavity formation. We will delve into these mechanisms to understand the pathogenesis of pulmonary cavities. In this section, we will explore the different imaging techniques used to diagnose and monitor pulmonary cavities. We will discuss the strengths, limitations, and applicability of chest X-rays, CT scans, and MRI in accurately identifying and characterizing these cavities. The role of each imaging modality will be explained in detail, providing a comprehensive understanding of their importance in the management of pulmonary cavities. Pulmonary cavities are often caused by Mycobacterium tuberculosis, Staphylococcus aureus, and anaerobic bacteria. Tuberculosis-related cavities have distinct features. Methicillin-resistant Staphylococcus aureus can cause necrotizing pneumonia and cavitation, while anaerobic bacteria are linked to aspiration or pulmonary abscesses. This section explores the microbial causes of pulmonary cavities, their transmission, and clinical significance. In this section, we will explore the connection between pulmonary cavities and tuberculosis. We will discuss the clinical presentation, diagnostic methods, and management strategies for patients with tuberculosis-related cavities. This information is crucial for healthcare providers in managing this complex condition. Interventional bronchoscopy techniques can diagnose and treat pulmonary cavities. Transbronchial needle aspiration samples adjacent lesions, aiding identification of pathogens. Endobronchial valve placement targets therapy in some cases, promoting cavity closure and preventing infection. Training and proficiency are crucial. Surgical management of pulmonary cavities is indicated in complex or refractory cases, where conservative measures have failed or complications have developed. Resection or decortication, either via a thoracotomy or video-assisted thoracoscopic surgery, VATS, is often required to eliminate the cavity, control infection, and promote lung re-expansion. Surgical interventions aim to eradicate the causative pathogen, remove necrotic debris, and improve lung function. Successful outcome depends on careful patient selection, appropriate surgical technique, and postoperative care. This topic will provide a detailed overview of the indications, techniques, and outcomes associated with the surgical management of pulmonary cavities, equipping medical students with the necessary knowledge to understand and evaluate these interventions. This section of the video will discuss the potential complications associated with pulmonary cavities, including hemoptysis, pneumothorax, and bronchopleural fistulas. We will explore their causes, symptoms, and appropriate management strategies. When encountering a pulmonary cavity on imaging, it is essential to consider a broad differential diagnosis to avoid misdiagnosis or overlooking other potential etiologies. Conditions such as lung tumors, cystic lesions, or bronchiectasis may mimic pulmonary cavities radiologically. Distinguishing between these entities is crucial for appropriate management and treatment. A thorough clinical evaluation, detailed radiological analysis, and consideration of patient characteristics and risk factors are essential in narrowing down the differential diagnosis. This topic will provide a comprehensive overview of other conditions that may mimic pulmonary cavities, guiding medical students and clinicians in their diagnostic approach and decision-making process. Medical management plays a pivotal role in the treatment and control of pulmonary cavity-related infections. Appropriate antibiotic regimens, tailored to the causative pathogen and guided by susceptibility testing, are essential. In the case of tuberculosis-related cavities, multi-drug therapy with anti-tubercular agents is the mainstay of treatment. Antifungal therapy may be needed in certain cases, especially when fungal pathogens are involved. Additionally, immunomodulatory agents can be considered in patients with impaired immune responses or extensive lung damage. This topic will explore the various pharmacological approaches for managing pulmonary cavity-related infections, discussing the recommended regimens, potential drug interactions, and monitoring parameters. In this section on pulmonary cavity formation, we will explore the immune response within the lungs. We will focus on the interactions between the innate and adaptive immune systems, discussing how they determine disease outcomes. The role of specific immune cells and the potential consequences of immune dysregulation will also be examined. This topic aims to provide a comprehensive understanding of the immunological insights into pulmonary cavity formation and their impact on diseases. Follow-up and long-term monitoring of pulmonary cavities are essential in assessing treatment response, complications, and the need for further interventions. Imaging, sputum exams, and clinical assessments are key for evaluating cavity changes, microbiological clearance, and overall patient health. In this section, we will explore emerging treatment modalities for pulmonary cavities. Genetically engineered phages, immunotherapies, and targeted therapies show promise in managing this condition. They offer a tailored and effective approach by targeting pathogens, modulating the immune response, and focusing on specific molecular pathways. Join us to learn more about the potential of these novel therapies. In conclusion, the study of pulmonary cavities involves various aspects like their causes, imaging, microorganisms involved, complications, diagnosis, treatment, immunology, and new therapies. This script aims to provide comprehensive knowledge to medical students and practitioners for optimal patient care. Staying updated is crucial in managing pulmonary cavities.